What if I told you that the strange buzzing pins and needles feeling in your feet at night is not just a sign of aging, but a quiet warning signal that your nerves are being slowly starved of the blood flow they need to survive? If you are over 70 and you wake up in the middle of the night with numb toes or your feet tingle for no clear reason after sitting in your favorite chair, most people do just one thing. They ignore it. They shift position, wait for it to pass, and tell themselves, this is simply what getting older feels like. But here is what surprises most of my patients when I explain it to them plainly. My name is Dr. Thomas, and in my 26 years of experience working with older adults, I have seen this pattern repeat itself more times than I can count. The numbness and tingling in your legs and feet is rarely about age alone. In most cases, it comes down to a small group of muscles in your lower legs and feet that have quietly stopped doing their job. And when those muscles go silent, your nerves pay the price. The good news is that gentle, targeted movement can wake those muscles back up. And in this video, I'm going to walk you through exactly how to do that safely, simply, and without any equipment. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. Exercise number 5, seated toe and ankle wake up. This is where we begin, and I want you to understand why we start here before anything else. When numbness and tingling affect the legs and feet after 70, the symptoms almost always start from the bottom up. The toes go first, then the ball of the foot, then the ankle, then it creeps upward. That pattern tells us something very important about where the problem begins and where the solution needs to start as well. Your toes and ankles are the lowest points in your entire circulatory system. When you sit for long periods watching television, reading, or riding in a car, blood has a natural tendency to pull in these areas. At the same time, the small muscles inside your feet and around your ankles become inactive. When both of those things happen together, the nerves in your feet begin to receive less oxygen-rich blood. And when nerves are deprived of the blood flow they need, they send distress signals. Those signals feel like tingling, buzzing, numbness, or that strange sensation people often describe as their foot falling asleep. Except after 70, it starts happening more often and taking longer to resolve. This first exercise directly targets that problem. It is done entirely in a chair, which makes it safe for virtually everyone, regardless of joint pain or balance concerns. Here is how to do it. Sit upright in a sturdy chair with both feet flat on the floor. Begin by slowly curling your toes downward as if you are trying to grip the floor through your shoes. Hold that position for 3 seconds, then gently release. You should feel a mild activation in the arch of your foot in the base of your toes. That sensation is exactly what we want. It means the muscles are waking up. After 10 repetitions of the toe curl, move into the ankle circles. Lift one foot just a few inches off the floor and slowly rotate your ankle in a wide, smooth circle, 5 times clockwise, then 5 times counterclockwise. Take your time. The circle should be large and deliberate, not rushed. Think of it as drawing a slow, careful circle in the air with your big toe. Then switch to the other foot and repeat. Research noted by the American Heart Association has found that gentle foot and ankle movement during extended periods of sitting helps reduce fluid buildup in the lower extremities and supports healthy venous return. These are not dramatic movements, but their effect on circulation at the foot level is real and meaningful. A common mistake is making the ankle circles too small and too fast. Smaller, quicker movements recruit very little of the surrounding tissue. What you want is a slow, broad circle that gently engages the muscles, tendons, and connective tissue around the entire ankle joint. Another mistake is tensing the rest of your body while doing this. Keep your shoulders relaxed, your breathing easy, and your focus on how your feet feel as you move them. For older adults dealing with numbness and tingling, this exercise is the foundation. It sends a clear signal to the lowest part of your nervous system that circulation is beginning to move again. Done consistently, many people notice within a few weeks that the morning numbness begins to ease and that the pins and needles feeling at night becomes less frequent and less intense. Exercise number 4, ball foot massage and nerve activation. Once the ankles and toes have been gently reawakened, the next step is to go deeper into the foot itself, into the muscles, pressure points, and nerve pathways that lie beneath the surface of the sole. For this exercise, you will need one firm ball. A tennis ball works well. A slightly harder rubber ball works even better. You will keep this exercise seated as well, which keeps it completely safe and accessible. Here is why this step matters so much. The sole of your foot contains an incredibly dense network of nerve endings. In fact, there are more sensory nerve endings per square centimeter in the bottom of your foot than almost anywhere else in the body. When circulation is poor and muscles are inactive, these nerve endings become compressed and underactivated. The result is that dull, muffled feeling, the sense that your feet are not quite connected to the rest of you. By applying gentle rolling pressure to the sole of the foot, you stimulate blood flow directly into the small capillaries that feed these nerve endings. You also begin to reactivate the intrinsic muscles of the foot, the small muscles inside the foot itself that most people never consciously exercise. To practice this, place the ball under one foot while seated. Rest your foot on top of it with gentle but firm pressure. Not so light that you barely feel it and not so hard that it causes pain. Begin rolling the ball slowly forward toward your toes, then backward toward your heel. Then roll it from the inner edge of your foot toward the outer edge. Then try slow clockwise and counterclockwise circles. As you do this, pay close attention to any spots that feel more tender or sensitive than others. These tender points are almost always areas where circulation has been most restricted. When you find one, pause on it. Apply steady, gentle pressure for 10 to 15 seconds, then continue rolling. Over several days of consistent practice, patients consistently report that those tender spots become less sensitive, a clear sign that blood flow is improving in those areas. After the rolling massage, try this additional movement. Position the ball under your toes and attempt to grip it with your toes, pressing down as if trying to hold the ball in place. This is surprisingly difficult for most older adults, and that difficulty itself reveals how much the intrinsic foot muscles have weakened. Even the attempt, even if you cannot fully grip the ball, sends a powerful reactivation signal to those muscles. Do this exercise for 5 to 10 minutes on each foot. Make sure you do both feet every time, even if only one foot is symptomatic. The body functions best in balance, and working only one side can create asymmetries over time. A common mistake is rushing the ball movements. Speed removes the therapeutic benefit entirely. Slow, deliberate pressure is what drives blood into the small vessels and reactivates the nerve pathways. Exercise number 3, supported heel-to-toe weight rock. After the feet and ankles have been reactivated in a seated position, it is time to gently introduce the body to standing, but in a way that feels safe, supported, and completely within your control. This exercise is done standing behind a sturdy chair or near a kitchen counter. You keep both hands lightly resting on the support at all times. Your feet stay hip-width apart, flat on the floor. The movement itself is simple. You slowly shift your weight forward onto the balls of your feet and your toes. Not quite a full heel raise, but a gentle forward lean through the feet. Hold that for 2 or 3 seconds, feeling the pressure shift toward the front of your foot. Then slowly rock your weight back onto your heels, lifting the front of your feet just slightly off the floor. Hold again, then return to center. The rhythm should be slow and flowing forward, center, back, center, like a gentle rocking motion, like the tide moving in and out. In everyday life, every single step you take requires this kind of weight transfer. When the muscles responsible for this movement become weak or poorly coordinated, walking starts to feel uncertain. People begin to shuffle rather than stride. They hesitate before stepping. That hesitation over time reduces activity, which further weakens circulation, and makes the numbness worse. Guidance from the Mayo Clinic emphasizes that supported standing movements improve lower limb circulation and neuromuscular coordination in older adults, particularly when balance confidence has declined. This gentle, rocking pattern retrains the feet, ankles, and lower legs to share and transfer weight efficiently, which is one of the most fundamental requirements for healthy circulation during movement. A common mistake is locking the knees. When the knees are rigid, the body cannot distribute weight smoothly, and the calves, which are critical for pushing blood upward, cannot activate properly. Keep a very slight natural softness in the knees throughout this movement. Another mistake is leaning the upper body too far forward or too far back to compensate. The movement should come from the feet and ankles, not from bending at the waist. Keep your chest open, your gaze forward, and your core gently engaged. For older adults experiencing numbness and tingling, this exercise begins to reconnect the nervous system's awareness of where the feet are in space, a sense called proprioception that often diminishes alongside circulation problems. Rebuilding it reduces the risk of stumbling, increases confidence while walking, and helps the legs begin to feel more present and reliable again. Exercise number 2, towel toe curl in a lying position. This exercise moves to the floor or to your bed if getting down to the floor is not comfortable for you. It is done lying on your back, and it specifically targets the muscles of the toes and the arch of the foot in a way that no standing exercise can fully replicate. Here is why this position matters. When you are lying down, there is no gravitational pressure on the feet and no balance requirement. This allows you to focus all of your attention and effort on the small muscles of the toes and foot arch, the muscles that are most directly connected to the nerve pathways that produce numbness and tingling. To practice this, lie comfortably on your back with your legs extended. Place a small towel folded flat under the toes of one foot so that your toes rest on top of it. Now, using only your toes, try to curl them downward and grip the towel as if you were trying to scrunch it up towards you. Pull with your toes. Hold the grip for 5 seconds. Then release completely. Repeat this 10 to 15 times on each foot. This movement is harder than it looks. Most people over 70 discover very quickly that their toes have almost no gripping strength remaining. This weakness in the intrinsic toe muscles correlates strongly with the degree of numbness a patient experiences, because these muscles play a direct role in driving microarticulation through the smallest blood vessels in the foot. When you begin this exercise, do not be discouraged if your toes barely move. Even the neurological signal, the intention to grip, begins to retrain the nerve pathways. Within a few days of daily practice, most people notice measurably more movement in control. After the towel curl, extend both legs flat and perform the final part of this lying sequence. Slowly rotate both feet outward, pointing your toes away from each other. Hold for 3 seconds and feel the stretch along your shins and the outer edges of your feet. Then rotate both feet inward, crossing your toes toward each other. Hold again. This gentle rotation stretches the nerve tissue that runs along the length of the lower leg, including the peroneal nerve, which is one of the most commonly compressed nerves in people who experience lower leg numbness. A common mistake is using the entire leg to perform the towel curl instead of isolating the movement to the toes. If you feel your thigh or calf working hard, reduce the effort and focus more specifically on the toes themselves. Exercise number 1, controlled heel raise and nerve stretch flow. This is the exercise I recommend most consistently to patients who come to me with ongoing numbness and tingling in their legs and feet. Not because it is the most demanding, it is not, but because it combines everything the legs need in a single flowing movement. It activates the calf muscles, supports venous blood return, stretches the nerve pathways along the back of the leg, and builds functional standing strength all at the same time. This exercise is done standing behind a chair with both hands resting lightly on the back for support. Feet are hip-width apart. Begin by very slowly rising onto the balls of your feet, a full heel raise. Take 3 full seconds to rise. At the top, pause and hold for 2 seconds. Feel the calves engage, Feel the pressure through the balls of your feet. Then lower your heels back down just as slowly. 3 seconds on the way down. Do not drop. Control the descent completely. Once both heels are back on the floor, add the next part of the flow. Gently bend both knees just slightly. Not a squat, not even close. Just a small, soft bend. Then straighten again. This brief knee bend recruits the quadriceps and hamstrings into the movement, which creates a coordinated muscle contraction across the entire lower leg. Exactly the kind of combined activation that research from the National Institutes of Health has shown to improve venous return and functional mobility in older adults more effectively than isolated single muscle exercises. After the knee bend, finish the flow with a gentle foot rotation. Toes out, hold. Toes in, hold. Return to center. This keeps the nerve tissue mobile and prevents the stiffness that contributes to nighttime tingling. One full repetition takes approximately 12 to 15 seconds when done properly. Start with 8 to 10 repetitions. Over time, work toward 15. The goal is never speed. The goal is deliberate, controlled movement that the nervous system can learn from and repeat. A common mistake is turning this exercise into something more aggressive, bouncing on the toes, squatting too deep, or rushing through the sequence. This is not a strength workout. It is a circulation and nerve activation routine, and its power lies entirely in the slowness and control with which you perform it. For older adults dealing with numbness and tingling, this exercise, when practiced daily, tends to produce the most noticeable results. Many patients report that within 3 to 4 weeks of consistent daily repetition, the nighttime tingling begins to reduce. The feet begin to feel more present. Walking feels more grounded and confident. Bonus, the vitamin connection. Your nerves depend on. Before we close, there is one more thing I want to share because movement alone will only take you so far if your nerves are lacking 2 critical nutrients. Over the course of my career, I have seen countless older adults do everything right with exercise and still struggle with persistent numbness, and in many of those cases, the missing piece was found in a simple blood test. The first nutrient is vitamin B12. This vitamin is essential for the protective myelin sheath that surrounds every nerve in your body. When B12 levels fall too low, that sheath begins to deteriorate, and the result is exactly the kind of numbness, tingling, and burning sensation we have been discussing throughout this video. B12 levels should ideally sit close to 350 or above. If yours are lower than that, speak with your doctor about supplementation. The second is vitamin D3. Beyond its well-known role in bone health, D3 plays a meaningful role in nerve function and muscle performance. A general recommendation is to maintain D3 levels between 70 and 80. If your levels are sitting at 30 or 40, that alone can contribute to the weakness and discomfort you feel in your legs and feet. Ask your doctor to check both of these at your next visit. These are not expensive tests, and the results can completely change the direction of your recovery. Closing. Over the last several minutes, you have seen that numbness and tingling after 70 is not permanent. It begins with waking up the smallest muscles, your toes, your arches, your ankles, and moves upward until circulation is flowing and your nerves are nourished again. When these movements are practiced daily, the changes are real. The nighttime tingling eases, the morning numbness lifts. Your feet feel present and reliable once more. Now I would love to hear from you. Is your numbness worse at night, during the day, or after sitting? Leave a comment with your age and where you are watching from. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.